depression, some frustration, whatever your religion is, a close friend is going to say, just pray, just forget everything and focus on praying for some times and you're going to be better. At least if even the problem is not solved, but you are going to feel a little bit better. So if this to be proven scientifically, how and why and with whom? We do have the answers to all those questions. The study is entitled Spiritual Energy of Islamic Prayers as a Catalyst for Psychotherapy. And the one who did it is Associate Professor of Psychology at the AUC, Dr. Hani Henry, who is here with us. So a very good morning to you, sir. We are very much delighted and honored to have you here. And of course, our first question, what's the relation? Tell us a little bit more about your study.
Sure. So let's just start by saying that I'm a psychotherapist, which means I can use psychological principles to help people deal with their difficult emotional experiences, difficult interpersonal patterns that they have with others, mood swings, anxiety. A lot of people have anger problems, right? So when people come, we use psychological principles to help them. We help them understand themselves better. We help them deal with the root of their problem. Sometimes it's the way they were raised. Sometimes it's the way they respond to stress that is not very functional. So this is the beginning point, right? Doing psychological science, applying it in real life with people to help them experience personal growth. Now, moving from the US, coming back here, you notice that religion is a central part of people's life. And a lot of people come to you and said, I prayed and I felt better. So as a practitioner, I felt it would be really a disservice for my clients not to have some sort of integration between the two, prayers and mainstream psychological therapy. So what I did is just actually try to scout the literature and see what the literature says about the benefits of prayer, psychological benefits. For example, prayers can help people experience subjective well-being. People really feel better after they pray, and there have been studies that have documented this. Sometimes people feel a lot of intimacy, right? They feel like they have a connection with a superpower, with a beautiful, energetic power, and then that makes them also feel better. Sometimes they experience humility. A lot of our problems is because we don't have humility, right? We need humility in our lives. We don't have to be always egotistic in the sense that it's me, and I need to be more connected.
Arrogance is a sin.
Arrogance, right? Also, it helps people with their interpersonal sensitivity. It helps, I mean, I can go on and on and on and tell you what research has shown what's the benefit, what are the benefits of prayers. Now, the trick about is like how to integrate it with mainstream psychotherapy. And again, the literature is very helpful. There are two schools. They say, if someone comes to you and say, you know, I have this regimen of prayer, like I do pray, you need to encourage it, you talk about it, but you don't include as a big part of your therapeutic intervention. This is what we call the implicit integration. You implicitly integrate it.
Among lines.
Right. Whereas there are there's another school that says explicit, which means what? It means like it's part of what you do. It's to, how was the prayer like? Did you integrate it in the techniques? For example, I teach people relaxation techniques, like how to relax and to deal with the anxiety. And then, all right, so while you're relaxing, maybe a prayer on the side can help. Again, you don't impose this on people. If people say to you, I don't really, prayers is not a big part of my life, of course, you're not going to go and tell people you need to pray, although you have the research that says it's important.
Dr. Hani, of course, these results are very good, but how did you reach them? I mean, these are not materialistic things in order to know how to measure them. So how did you feel that there is an improvement?
Right.
Was it only you ask the patient and you get a feedback from him, or how did you measure it?
Well, when you conduct research, you start with the body of literature. So actually the body of literature is saying that there are statistical data. For example, they compared between people who pray and people who do not, and they control for all confounding variables. Like they compare them along almost every aspect of their life. And the only difference is prayer. Then they found subjective well-being. They measure it through a survey and then check it's high.
Yes.
Interpersonal sensitivity survey. There is a scale that says interpersonal sensitivity. There is a whole body of science. I didn't invent this. All what I was saying is like, I actually noticed that this is also happening in the Egyptian context. This is what Egyptian clients of mine experience that as well. And so, you know, and as a clinical psychologist, we tend to have a kind of research called qualitative research, where you do intensive case studies. So I had a couple of case studies, but in the journal,